Good morning, this is Dana Parsons, and welcome to our Coronavirus Weekly Member Update. We appreciate you all taking the time to be on today. We have a couple of issues that we're going to be talking about. First is the new Advanced Certified Nurse Aide course that we're really excited to tell you about. And then we're going to move into an overview of the new workplace safety rule. So we are very pleased to let you know that I think some time ago you learned about a grant that we received through CMS to create a curriculum for an advanced certified nurse aide course. Okay, if you could, next slide. The Advanced Certified Nurse Aide course is a course that we are able to provide through scholarships, through the CMP grant that we received from CMS. We have been working with the Blue Ridge Community College and Sunnyside to develop a curriculum to allow CNAs in nursing homes to become advanced certified nurse aides. Next slide. The Advanced Certified Nurse Aide course is going to focus on 4 areas: leadership, care of the resident with cognitive impairments, restorative care, and wound care. Next slide. The course is going to include various areas of learning, team building, effective communication, care of residents, restorative care, and so forth. They're all listed there on our PowerPoint. Next slide. The CNA who is interested in applying to participate in this course, which will be scholarshiped through the grant that we receive through 3 semesters, will have to provide a copy of their current Virginia Nurse Aide certification, proof of being a certified nurse aide, and a recommendation for the advanced certification from a licensed nurse who provided supervision for the applicant in providing direct patient care for at least 6 months within the past year. Next slide. So basically, for 3 semesters, beginning on August 18th, the Blue Ridge Community College will be able to offer, through scholarships, through the CMP grant, a course for 10 students. There are 4 slots available for the course at this time that will run through November 5th. If you are interested in having a CNA participate in this course, please send me an email and I will get the application to you. There will then be 2 follow-up semesters with 10 students each that will be completely scholarshiped. 54 hours of the program will be done online, and the remainder of the program will be done on a clinical site location. But we can get more information to you on that. If you're interested, please send me an email and I will share the information with you. Next slide. So I am going to hand it over to Tracy with the Department of Labor. Thank you so much for joining us today to talk with us about this new regulation. So over to you.
Not. Can everybody hear me now?
We can. Thank you.
Okay. So I'm going to talk about the new emergency temporary regulation that's coming out. It's going to be, and we'll cover when it actually is coming out, but probably next week. So who and why do we need this regulation? Well, it's actually to prevent the spread of viruses in the workplaces. It's going to apply to every place of employment within the VOSH jurisdiction. So if VOSH can go into your site, it will apply to you. And for those that might not be familiar, VOSH is the Virginia Occupational Safety and Health Program. And it's based on exposure risk levels that is determined based on what type of job tasks are being done. and it's defined as the very high, high, medium, or low. The dates, when is it going to affect? Well, training dates are within 30 days from the time it's passed. It has to be put into the newspaper and published, and I believe they're looking at July 27th for that. Once that is done, then it takes effect immediately. Again, the training dates are 30 days after that. And that is for the very high, high, and medium classifications. If you have to have a infectious disease preparedness and response plan, which we'll talk a little bit about that, most of you guys in this industry have to have one because you're in the very high or high risk categories. You have 60 days to create the plan and train your employees on it. So to sum all this down, it's, I believe, a 35-page standard that they came out with from the Safety and Health Codes Board. I'm going to really condense a lot of it to help you. So the first thing is you need to protect your employers. This is very important, and that's going to require a lot of different things on your part. My mouse does not seem to want to move. There we go. So you're going to want to do social distancing all the time, and I'm sure most people know now that social distancing is required no matter where you go. Encourage self-monitoring. Encourage the employees to take their temperatures before they come to work and monitor how they feel. Post signs at your facility. Most of you, from what I understand, are nursing homes or assisted living, places like that. Post signs requesting that any patient or family member, if they feel sick, that they report the symptoms immediately to you. Offer them a disposable face mask. Separate them from other people until they can leave or go get medical treatment. PPE is going to be required. Most of you already use PPE, I'm assuming, which again is your personal protective equipment. It's got to be used and used properly, and you have to do some training on that. You have to provide access to sanitizers like soap, water, the alcohol content, hand sanitizers. You've got to have all that stuff around to help protect your employees. You've got to train the employees. And you cannot permit workers that are known or suspected to have COVID-19 to remain at work. And that includes if you have contract workers, you have temporary workers coming in from another agency. You talked about your CNAs, if they're working at more than one location. They're the ones that you're going to have to protect as well. Let's see here. So you got to assess your workplace. That's one of the first things that you're going to have to do in order to come up with your risk level. And we'll talk about the risk levels now. So there's lower, medium, high, and very high. Your lower risk, they're the people that do not require contact within 6 foot of people that might be infected or are infected with COVID-19. They have minimal contact with the public. Think of like an office person that sits in an office that doesn't go out very much. Your medium risk, that requires more than minimum occupational contact within 6 feet of people that could be infected with the COVID-19. Your high risk would be the high potential for employees exposed inside the 6 feet. These are the ones that actually provide care to people, like your medical, your EMS staff, things like that, your mortuary staff. Very high risk is a high potential for employees exposed within 6 feet. This would probably be where you guys fall into for the most part. There's not a lot of difference between high risk and very high risk on what the requirements are. So how do you determine your exposure risk? Well, you have to look at the task. Now, you can have people at one location that do multiple tasks. Each task would be a risk level. So if you have an office person, maybe their exposure level would be a low, but yet you have a nurse that is in the room with the COVID patient, that would be a very high risk. So it's based on the actual task, the work environment, where they are, what they're doing, how much they contact people, the presence of the virus, if it's known, if it's not known, if it could be there and you just don't know it, the number of employees and the size of the area. If you have 6 people working in a little tiny room, that could be an issue. That would be a hazard. The duration and frequency of exposure, whether it's over 8 hours or it's 6 times a day for 10 minutes, that all has to be taken into consideration when you're doing your exposure risk level. And then the hazards encountered, including your exposure by contact with a contaminated surface. So it's not just people as much as it could be on the surface or an object and the airborne transmission. That's all things that you need to take into account when you're doing your risk level. So training, what type of training do you have to do? So for your very high, and medium, you have to do your risk assessment. You have to train on the hazards and characteristics of your SARS and COVID-19. You have to have each employee be able to recognize the hazards and the signs and the symptoms of it. And you have to train each employee on the procedures to follow in order to minimize the risk. So it's not just, yeah, one and done, that's it. You have to actually involve them into the training and help them understand what it is. It has to include the requirements of the standard, which the Department of Labor is working on putting the training out for everybody. I gave you guys, this is a very condensed version that kind of pertains just to your work environment. But we are having documents, and they should be up by, I believe, next week at least, of what the required training is and actually give you the training. You have to include the characteristics and the method of spread. So how is it spread? The awareness of it, the risk factors, and especially the risk factors if there's people have underlying medical conditions that they might be at higher risk. You need to train them on this information. Again, awareness of transmission if they're showing symptoms or if they're not showing symptoms. Safe and health work practices. You need to train them on disinfecting when it's required, distancing, non-contact method of greeting, explain the difference between disinfecting and cleaning. Now, being in the healthcare industry, you probably know 90% of this and are doing all of this at this point in time, but this is really set to what is not being done. You got to kind of look at the regulations and say, your PPE, when it's required, what's required, how to put it on, take it off, use it, adjust it, especially the limitations in the care and the maintenance of it. Most people don't understand what the limitations are. They think they're wearing PPE and it's all great. It might not be the right PPE for the job. That goes back to why you have to do your PPE hazard assessment. And we are developing documents that will help you do that as well. You have to explain about the anti-discrimination policy. You cannot discriminate, you cannot fire anybody if they bring a concern to you. And the infectious disease preparedness and response plan. And we'll talk a little bit about that. When I was talking to Dana, she said that you wanted to know some more information on that. So I did put a lot of information in here. The mandatory and non-mandatory requirements in any CDC regulation or the state of Virginia guidance documents that you're complying with in lieu of any provisions in the standard as provided in the section, just train them on it. If you're following the CDC guidelines, train them on that and what you're actually following. Policies. You need to make sure you have current policies and written so people can look at it and understand it. It includes sick leave policies, telework, and staggered shifts, and inform the employees of the Families First Coronavirus Response Act. The policy should be to help people and not to make them not want to tell you they are sick. So when you're doing your sick leave policies and stuff, you want to make sure that it's very flexible. That's the biggest thing that we're pushing, is make it flexible to help your employees. Provide the policy and procedures on self-reporting and monitoring. Have them have a procedure in place that the employee knows, and you train them on that. If they're feeling sick, if they're showing any signs, who they report to, how it's monitored. Have a system in place for reporting positive test results. If you send employees to be tested, have a system so when the positive comes back, you know who you need to notify. It goes back to the quote contact tracing, because you're going to have to notify the people that could be exposed to them that there might have been a positive, all the while keeping the name out of the equation because you still have to follow HIPAA guidelines.
Hey,
Return
Tracy.
to work procedure. Yes.
Sorry to interrupt you. I just wondered, some questions are coming in the chat box. Would you like to address those at the end, or would you like to deal with those as you're going along?
Can we do them at the end?
Sure, Absolutely.
That would probably be the easiest because this isn't very long.
Okay.
And I
Okay.
prefer more
Great.
questions.
Okay.
So yeah, we'll do them
Thank
at
you.
the end. Sure. Let's see. So your PPE assessment, okay? This is your personal protective equipment assessment. It has to have the hazards or the job tasks that are present. So again, if you have somebody working in an office, their job or task would be office person. And then you would say whatever hazards that are associated with them. Are they going to be exposed? How often is the exposure? Is there a hazard prevented, or is there a hazard present for them? What PPE can protect them? That information you're going to have to do for each of your jobs. Now you can take and make it so if you have multiple people in an office, they might be just in different offices, you can group them together. So it's not necessarily doing it for every single person, it's doing it for the whole group as a whole. Oh, sorry, that was my fault. Now I lost where it was. Okay. So your social distancing, you're going to want to talk to them about social distancing and stay 6 feet from other. Again, being in the healthcare industry, you probably know, you probably have the little dots on your floor saying 6 foot. You adjust that when you go to the market, the stores, they have the little dots, they say 6 foot apart. Everything is distanced in 6 foot. You want to ensure that employees observe physical distancing at all times on the employer's property, and this includes in break rooms or common areas. Use verbal announcements, your signage, visual cues to put up and promote about social distancing. The CDC website has a lot of good resources for printing pictures out and hanging them up. You might have to decrease the workplace density by limiting non-employee access. If you have a lot of visitors coming in to see your patients, you might have to limit that, which I'm sure some of you have already done that. Restrict it only to certain areas that they can go to. The common areas, again, they should be controlled or closed. Employees, they can be required to clean and disinfect the area immediately which they were located in, or the employer can provide cleaning. So if you're an employee and you're in the break room, you can either require that employee to clean up their area and wipe it down before they leave on their way out, or you can have the company hires like a cleaning service that comes in every so many hours and they wipe everything down. They have to provide hand washing and sanitizer where available. Most places have that. Your hospital, I'm assuming that you have, or hospital nursing home, you have hand sanitizers and you allow people to wash their hands. At your common areas, like your lunchrooms, at the entrance, you're going to need to have signs that say the policy limited the number of people in the space. How many people can be in this space due to COVID? There are signs, again, on the CDC that you can print off and you just write the number in. You can order them, you can make them up, whatever you want to do. The requirements for physical distancing, the requirements for hand washing and sanitizing, and the clean and disinfecting of shared surfaces. So your whole common area, lunchroom, break rooms are going to have all kinds of signs now. Let's talk about cleaning. Basically, clean and disinfecting objects and surfaces regularly. I gave you the link on here for the list N, which is what everybody talks about for the disinfectant use and what chemicals can be used. So no matter what, the employer has to ensure that the chemicals are there for cleaning, okay? And that also means that they have to have preventive measures in place for cross-contamination of work areas. So if you have that office person and you have that nurse, the cross-contamination of both of them going into the break room, you have to have a way to protect both the employees so there is no cross-contamination. When engineering work practices or administrative controls are not feasible or provide sufficient protection, that's when you have to go to PPE. We use that as a last resource. We'd rather engineer it out. If you can put sneeze guards up or weight stuff down, anything that you can do to limit an administrative action or PPE requirement, that's the best way to go. Face coverings. I'm sure most of you all wear face coverings now when you go out, whether you're at work or at the store. If you're out in public, you have a face covering for the most part. Put signs up that talks about the face coverings and that they're required. And again, offer them for people that come in that might be sick. So we're going to talk about the infectious disease preparedness and response plan. Because you guys are in a very high and high risk, you have to develop and implement the written plan. If you're medium exposure with 11 or more employees, yes, you have to. But because of where you guys are and what you do, from my understanding, you would be very high and high, so you're required to do it. The plan and the training requirements need to apply to those employees that are classified as very high, high, and medium, okay? You need to designate somebody that is in charge and responsible for this plan. They need to know what is required in the plan, and they need to be informed about it. The plan has to have the name and title of the person responsible for administrating it. They have to be, again, knowledgeable in infection control principles and practices as they apply to that facility. They have to provide for employee involvement. So ask your employees that are there to help create the plan. It's to their benefit. It makes them more involved, and now they take ownership of it too. Consider to address the levels of risk associated. So again, you have one job site, but multiple different levels of risk assigned to people. Make sure it addresses each single one of them risks, whether it's high or low. You want to address that into there and the task. You have to have the where, how, and to what sources the employees might be exposed to at work. So if it's the general public, customers, patients, you got to put that into your plan. How they're going to be exposed if they're at high risk. Situations where the employees, if they work more than one job for different employees, so if they work at 2 different nursing homes or 2 different hospitals, put that into there and how it's going to be addressed. Again, HIPAA, you got to follow that. Look at putting into your plan certain risk factors that could affect their exposure and compromise them. You can put that into your plan as well. Engineering administrative work practices and PPE controls as necessary. So if you're engineering out how these guys are going to do their job by changing the room or putting a plastic barrier up, put that into the plan. If you're saying, okay, they can go into this room, but they have to have this PPE on, that has to go into the plan. It has to address the risk that the employees are exposed to. Consider also putting in your plan a contingency plan for situations that can result as another outbreak. We keep hearing on the news that, you know, it's only going to get worse, it's only going to get worse. So put into your plan, how do you address the employee absenteeism if everybody, you know, you have a lot of people get sick? The need for physical distancing or staggering your work shift, downsizing the operation. Can some of your office people work from home? When you have deliveries, can you take and make it so the delivery folks leave the stuff on the dock and then somebody goes out and wipes it down and then somebody comes in and brings it in so there's no cross contamination there. Options for conducting essential operations with the reduced workforce. If you've got 4 or 5 people that are out sick because of this or on quarantine or self-quarantine, how are you going to continue to deliver your services? How are you going to continue to care for the patient? That should be put into these. Interruption of supply chains and delayed deliveries. Again, you go to the store and, you know, when this first came out, there was no toilet paper. I don't know why, but there was none. And eggs were another thing. So plan for that and how you can get around it and how you can make things work. You want to identify your basic prevention measures that need to be implemented. So the frequent hand washing, when they should wash their hands, where they should wash their hands. If customers are coming in or visitors are coming in, do you require them to come in and wash their hands before they go through a certain door or into an area of the home? You can do that. It's just kind of like mitigating the circumstances. You're not going through here until you go in. My dentist requires me when I go in to wash my hands, dry them, and use hand sanitizer before I can go back into where they're going to work on it. Maintain regular housekeeping practices, including routine cleaning for disinfectant surfaces and equipment. Have a schedule of when things get cleaned and what they're supposed to do and who's cleaning it, and then how to dispose of that material so nobody can get contaminated by it. Establish policies and procedures for managing and educating the visitors to the place of employment. You guys have a lot of visitors that come in, a lot of family members that probably are not sure what to do and they just want to see their loved ones. Make sure you have the policies and procedures in place in your plan so you can educate them before they come in. Whether it's a one-page handout you give them or it's a training video or something you watch, have something there so they can see it. Provide for the prompt identification and isolation of known or suspected employees away from work, including procedures for the employee to report it. So the employee doesn't feel good. Have procedures in your plan so the employee knows, hey, I'm not feeling good. I'm showing signs. I need to report it to person A. Take them out of that work environment, set them into another room until they can go home or get medical attention. At my church, we call it the COVID room. If somebody's not feeling well or whatever, they go right to that room, and that's where they stay until we either get medical or they can go home. Address infectious disease preparedness and response with outside businesses. You guys probably have a lot of subcontractors or temporary workers that might come in. You need to address that. And this goes with like your delivery people, temporary staff, temp agencies. Ask them how they're doing it. Put that information into your plan and make sure that they understand what you guys do. And if they have somebody that doesn't feel good and that is COVID, make sure they tell you. That's a requirement. They should tell you. Identify the mandatory and non-mandatory recommendations in any CDC guideline or guidance doctor that you're complying with. So if you already have a Department of Health guideline that you're following, identify that in your plan. So that way, when we come in or anybody comes in, you can say, this is what we're following, okay? Ensure the mandatory requirements of any Virginia executive order or order of public health related to COVID is followed. And again, stop the spread. Control, prevent, mitigate the spread of COVID. That's the only thing that is going to help flatten the curve or make this go away. Familiar yourself with this new standard. They will be, I believe, coming out with probably a permanent one they're going to be working on. So this is just the start. And then we have consultation services. So if you want to come and request a on-site visit or a virtual visit, you want to have training done on it, we can provide that to you. So now I can answer any questions because I went through everything that I'm supposed to. So let me go back up here into the chat. Let's see. Okay, will you receive a copy of the slides? Yes, I believe Dana has the slides, and I believe she's going to be sending them out to everybody. Also, on our website, we are going to be uploading a bunch of templates, and we are going to be your hazard assessment, training guides, PowerPoints to help you train your folks and your employers. We also have a sample of a hazard, the plan that you need to fill out. That's going to be uploaded too. They're all in the final stages of being reviewed, so that will help you guys. Let's see. If you have been following CDC and OSHA guidelines, shouldn't you already be in compliance with the new law? Well, yes and no. You should be in compliance for the most part, but the CDC and OSHA guidance didn't say that you had to have an infectious control plan. Now we're saying you have to, and we're determining it by the risk factor. So yes and no, you should be in compliance with most of this stuff. But as you know, when you go to the grocery store in the market, people aren't in compliance. What is new or more restricted about this law versus OSHA? The plan, and now it's a definitive. this is actually given us something that we can go in and cite. OSHA doesn't have an actual regulation standard that we can go and cite except for general duty. This is like Virginia has unique standards. So because this would be a unique standard, we can actually cite different parts of this. Otherwise, we would have to go through OSHA, and that one's a little bit harder because they don't have anything that addresses the pandemic. Let's see. Is there a mandated testing requirement for staff to work in or return to work? If you have a positive, when you look at the regulation, it talks about how to have people come back to work, and that would be in your plan. So if you have somebody that tested positive, they can very nicely be returned to work after. You can either use the number of days, or you can use a two negative tests in a row. It depends on which one that you're going to follow. And in your plan, that needs to be specified. As for mandated testing, that would be an HR thing. We're not mandating anybody be tested. That's up to you and how you want to do your HR stuff. Okay, the slides will be included. The weekly testing is a mandate that could be enforceable by a deficiency of a CPM, or is the weekly testing simply a recommendation? We don't say when you have to test. That would be up to you, and that would be something that you follow. Whenever you test or required to be tested, that should be in your plan of saying this is what we do. The HVAC and air controls. There's a whole section on that. I did not include that into the PowerPoint presentation, but it talks about the air handling, and it talks about how, I'm going to bring it up here because I don't want to misspeak. It talks about what the air handling needs to meet for the requirements of it, and that it has to be followed by manufacturer recommendations. And let me see here. Levels. I'm getting to it. Air handler. Bear with me here. I didn't have that one brought up. There are waivers also. If somebody cannot wear a mask, there are waivers that they can get. It has to go through the department, and we don't just offer them out, but there's waivers. Okay, so your air handling systems are to be installed and maintained in accordance with your manufacturer instructions. They have to comply with the minimum American National Standard Institute, basically ANSI, for refrigerating and air conditioning engineers. So yes, you will have some air sample or air strategies that have to be followed. They have to be maintained for the manufacturer's recommendations. And we actually, one of our services is actually offering air sampling. So if you want, you can request that we come in and can do air sampling for you. I think that answers them all. Is there any other questions?
There was a question, it might be more for Sarah Lineberger, who I know is on. Hate to put you on the spot, Sarah. A member asked if the weekly testing is a mandate that could be enforceable by a deficiency or a CMP fine, or is the weekly testing simply a recommendation or best practice? Sarah, are you on? Okay, well, we can come back to that. So Tracy, the regulations in the area you were just addressing, will you be able to provide those soon so that we can share those with the members to review the actual document?
They will be uploaded to our website. They are putting everything on the website because there is so much information. The Department of Labor and Industry was tasked with not only helping with the standard and doing the standard, but providing all documentations and training for the employees and the employers. So currently we have low risk training. We have a sample hazard assessment, how to do the PPE hazard assessment. We have the emergency temporary standard training, which it's like 102 slides long, and we're going to group that. We're going to make that smaller and divide it into 4. So it'll cover your lower training and then the medium, high, and very high training for the standard requirements. We have the infograph, we have a toolbox talk, we have a training certificate. So as these start getting vetted out and approved, they will be going up on our website. So the best thing I can tell you is I'm not sure when they're going up on the website. I know they will be up there by probably next week, but just keep going and checking our website for it.
Okay, that actually addresses a comment that just came in. Will a template program and training template be offered? So it sounds like
Yes.
all of that will be coming up on the website soon.
Yes, it will. The training program is going to be a PowerPoint, and you'll have to sit through the whole PowerPoint, and then at the end you have there's a certificate required that you have to fill out, because remember, your training has to be documented. So there'll be a sample document that you can print off and use as your training certification.
Okay, and I see Shayna is on from the Department of Health. Shayna, did you want to address that question? Are you available about the weekly testing?
Can you repeat the question?
Yes, a member asked if the weekly testing is a mandate that could be enforceable by a deficiency for like a deficiency during an inspection, or a civil monetary fine, or is the weekly testing simply a recommendation best practice?
When we've talked to OLC, who are the ones that survey nursing homes, they have said that that's not something that is sort of citable, but I think they're still gathering more information. What they're looking for are these types of plans, similar to what was reviewed, your infectious diseases and response plans. What is your plan for testing? What is your plan for screening? That's what has been told to us in the office of Ed.
Okay, thank you. Was there someone that wanted to ask a question? Okay. Thank you, Shayna.
So I see that. Go ahead. I see that somebody asked about required face mask waiver, even though the guidance requires it. So we say that, and I quote from the standard now, nothing in this section shall require the use of a respirator, surgical, medical procedure mask, or face covering by any employee for whom doing so would be contrary to their health or safety because of a medical condition. However, nothing in this standard shall negate an employer's obligation to comply with personal protective equipment and respiratory protection standards applicable to the industry. So basically, if they come to you and they say their doctor says they can't wear a mask, or they have a religious waiver for the required use of respirators, masks, or face masks, that will be handled in accordance with the requirements of the federal state regulations after a consultation with the Office of the Attorney General. So there's other ways to protect them. If they can't wear a mask, maybe a face shield, or putting a plastic barrier up between them, maybe rotating them out so they're doing a different job and not necessarily having to wear the mask there. That would be something that you would have to address in your plan. I know for me, sometimes I have a hard time with a mask. I'm honest, I have asthma. It's hard to breathe sometimes with the mask on. I do what I need to do to help protect me and everybody else. So if I choose to go to the store, I know I have to wear it. I know there's people out there with PTSD that the mask makes them feel like they are being suffocated and they can't do it. There's all kinds of reasons, but that needs to be addressed in your plan.
Thank you. Yes, any other questions? And I wanted to give the department Virginia Department of Health an opportunity to respond if there was anything that they heard that they wanted to provide any clarification on. So sorry, Shayna, I keep putting you on the spot.
Yeah, maybe just one thing about the retesting to return to work. The CDC did just update their guidance, and they are recommending that symptom-based strategy and opposed to that test-based strategy. So I encourage everyone to go to the CDC's website. They have a decision memo out on this that kind of reviews some of their data. This is an update, so we're working this week on updating all of our VDH documents, but I encourage everyone to go to the CDC site and look at that return to work criteria and read through it and read the decision memo.
We'll also include it in our update today, Shayna. Thank you. Okay, are there any other questions? I wanted to get everyone's attention, though, before you hang up. If you do have a question, please put it in the chat box. But I wanted to bring to your attention that next week's call is going to be dealing with the funding, CARES Act funding. DMAS is going to be providing an overview on how that funding will be distributed and the process specifically for assisted livings to make sure that you're getting that funding. So I wanted to make sure that all of you all were aware of that and become ready for your questions. We will include a breakdown of the proposed process so far in the updates that we're sending out about the call, but just wanted to let everybody know that that'll be on July 29th at 11 a.m. And that's going to be a really important call. I know that funding is a major issue for a lot of you on the phone, and I just want to make sure that you participate and get the information that you need. A link to the guidance that Shayna referenced is in the chat box, and we'll also be inputting that in our update today as well. So one last call for questions. Well, thank you, Tracy, and thank you, Shayna, for being on. We appreciate the overview. We will keep everyone updated as the training and guidance becomes available. That'll be included in our updates. So it looks like we'll be ending 15 minutes early today. So I hope everyone has a great rest of your week.